Mixed messaging contributing to vaccine hesitancy among high-risk populations. That's the worry tonight from a group of prominent black scientists. They say with continuing media coverage of the truck convoy and misinformation being spread by some of its supporters, they fear that the messaging could disproportionately impact black communities.
Those are the very communities or neighborhoods that are facing higher COVID risk of hospitalization and mortality.
Communities like York University Heights, where just 39% of residents have received a third shot of a COVID-19 vaccine, or Mount Olive, which right now has only about 26% of its population boosted, or neighborhoods like Weston, where, according to the city's website, only 77% of residents have received a first dose. The average for Toronto is 88.
Well, the message that public health measures are problematic during a pandemic, and especially during this phase of the pandemic, when we're dealing with an infectious virus like the Omicron variant, can only undermine the confidence of people, especially members of vulnerable communities.
Dr. Awatu Kenti is a member of the Black Scientist Task Force on Vaccine Equity. He's raising the alarm tonight, saying images like these are harmful for already hesitant racialized communities.
It undermines the capacity to build community immunity, especially where there is an absolute necessity to do so because those people can't work from home.
We're making a concerted effort to get vaccinations out into our community.
To increase awareness and trust, the city has worked on providing access to vaccines within high-risk neighborhoods. This weekend alone, the Scarborough Health Network hosted the Family Roll Call Vax Weekend in an effort to encourage families, especially those who remain hesitant, to get the jab.
At least 4 to 5 times chance more of getting into ICU if you're not vaccinated. If you are a betting man or woman, where would you bet? Where would you put your resources? Protecting yourself and your family in the best way possible, or taking a chance and just dealing with it?
Dr. Kenti says the black community has specific health and systemic race issues that could get lost while the focus is switched to the protesters, such as higher risks of COVID because of social factors. He also says the spread of misinformation only leads to more mistrust of healthcare and public health.
So I respect every community, every individual's right to express their support for or lack of support for public policy. However, I think it's important for me to say that no one has the right to call into question the humanity and the historic suffering of any of their fellow Canadians.
The task force is urging anyone who remains hesitant to do more research to distinguish the difference between science and quasi-science. They can also head to torontoblackcovid.com for more resources. Melissa Nakhavoly, City News.